Gorman because my family called me Frank, whether my first name is Richard. But I wish to give you a tutorial on my book, The Scientific Basis of Spinal Manipulation Therapy for Constitutional Illnesses. And by constitutional illnesses, I mean illnesses like sinusitis, asthma, dermatitis, blocked nose, all those various things that the walking wounded suffer from. And the book, in this, we will go ahead to do each chapter in turn. And today I want to start you on the first chapter, which describes Dr. Milne and his wonderful achievements in bringing chiropractic into orthodoxy. He was a master of spinal manipulation. He graduated from the University of Aberdeen. When he was doing his resident years as an intern at the hospital, they would have a spinal manipulation list at the end of the surgical list. There he learnt the principles of spinal manipulation. Later he was to be the main person bringing spinal manipulation into the forefront of orthodox medicine. Now, Dr. Milne came out to Australia and settled in Mount Isa, which is associated with the Mount Isa copper mine in the outback of Australia. And there he, in the 1950s and 60s, he started using depolarising muscle relaxants to facilitate spinal manipulation. And doing that, he, as a forefront in the world doing that, he's worth 5 Nobel Prizes. The first Nobel Prize was really that he found that people with ictal migraine, people with prostrating migraine headaches, they got better permanently with one spinal manipulation done under anaesthesia with depolarising muscle relaxation. So that was his first Nobel Prize. The second Nobel Prize he should have got for finding out that these patients, not only did they get better from the migraine, the terrible migraine attacks, but they also got better from a great variety of other non-specific symptoms, chronic other headaches, dizziness, tiredness, sexlessness, poor concentration, poor ability to learn at school, irritability, inability to sleep. So many symptoms all came out, and what would happen, the patients would come back to Dr. Milne after having one of his spinal manipulations and say, look, these other things have got better as well. So in fact, Dr. Milne worked out what the illness was that occurred to migraine patients when they were in the headache-free periods. And that nowadays is called interictal migraine, and there are great efforts to find out what drug treats it. The next thing that he found was that if you look at these people with interictal migraine in the headache-free periods, a lot of them have an abnormality of vision, a shrinkage of the vision towards the centre, a lowered sensitivity of vision, and this is referred to as tunnel vision or hysterical amblyopia. Now, Dr. Milne found, just finding that there was a measurable abnormality associated with migraine of this nature, which was worth another Nobel Prize. And he then demonstrated that it would get better regularly, almost always would get better if the spine was manipulated by his technique using the depolarisation muscle relaxation. So we have a situation that he defined what interictal migraine was really 40 to 50 years before the literature that's coming out now. So that when people look for a way of treating interictal migraine, and there are a lot of studies being done at the moment to work out what drug can treat interictal migraine, Dr. Milne would save them a lot more money, because if the drug that they wanted to use couldn't make the vision aspect of interictal migraine better, then it really wasn't a satisfactory one to proceed to investigate. So that would have saved the community millions, will save the community millions of dollars. But all it needs is for the whole idea of what Dr. Milne discovered in 1960s and 70s and have that brought forward so that the rest of the world understands what he achieved. Soon we'll go ahead to deal with Chapter 2, which takes us into the science of this migraine illness and its treatment by spinal manipulation.